who is a Vice President of the Provincial Health Services Authority and is here as the Deputy Provincial Health Officer today. And this is our COVID-19 briefing for Thursday, August 20th. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh. Tomorrow, Friday, August 21st, we'll be providing a written briefing, Dr. Gustafson and I, at approximately 3 o'clock with case counts and other relevant information. On Monday from Victoria, I'll be joined by Dr. Bonnie Henry, and we'll be providing a briefing in person on that day. And with that, it's my honor to introduce Dr. Réka Gustafson.
Good afternoon, everybody. Again, I'm Réka Gustafson, Deputy Provincial Health Officer, and I'm going to give the public health briefing today. And thank you. So today we are reporting 18 new cases in British Columbia of COVID-19 in the last 24 hours, bringing the total since the beginning of the pandemic to 4,825 COVID-19 infections. By health authority, 1,526 are in Vancouver Coastal Health, 2,533 are in Fraser Health, 159 are in Vancouver Island Health Authority, 411 were in the interior, and 121 were in Northern Health. 75 infections were among people who came from outside of Canada. Currently, we have 780 active cases, of whom 11 are hospitalized and 4 are in critical care. 2,574 people are at this time under active public health monitoring. We are sad to report 2 new deaths in the Fraser Health Authority, bringing the total to 200 deaths in British Columbia due to COVID-19. Our sincere condolences to all those who have lost friends and loved ones during the COVID pandemic, and in particular to those who lost loved ones recently. At this time, 3,845 people are fully recovered from their COVID-19 infection. There are no new healthcare outbreaks reported today. There are, however, 9 active outbreaks being monitored by the health authorities in our healthcare system. 8 of those are in long-term care facilities or in assisted living, and 1 is in acute care. Among community outbreaks, there has been 1 new community outbreak with 9 confirmed cases of COVID-19 at Loblaws reported in the Fraser Health Authority. Fraser Health Public Health teams are on-site managing this cluster. In Haida Gwaii, there is an outbreak that's being actively monitored, and the update on that outbreak is that everyone in that cluster is at this time considered fully recovered. Public Health will continue to monitor for potential new infections until the outbreak is declared over. Health authorities continue to issue community exposure alerts for a number of locations and flights coming into and out of BC. Please do check these websites regularly to make sure that you are up to date on any potential exposures. So what do today's numbers tell us? We do continue to see new infections in British Columbia. The number at this time is relatively stable, but we are continuing to see them. The number of people in hospital and intensive care units remain low. We are seeing a small increase in infections in the 40 to 60-year age group. We are carefully monitoring this trend because we know that the risk of severe illness goes up with age. And the 2 new deaths in long-term care facility, of course, reflect the vulnerability of this population to severe disease from COVID-19. The COVID-19 pandemic has really been hard for many of us. We have seen in this year's population health survey from British Columbians that their mental health and sometimes their economic well-being is really being affected by the COVID pandemic. We have had to change many things and learn new ways to safely live our lives. Yet British Columbians have shown incredible resilience and caring and fortitude in this pandemic. In addition to COVID-19, in recent weeks, parts of the province have also had to manage forest fires. And COVID-19 brings an added complexity to that, especially if you have to self-isolate, especially if you're at risk for severe disease. I can only imagine how hard that must be. And I do want to assure you that public health is working with emergency management to support you at these difficult times. I would like to talk a little bit about gatherings. We are actually fortunate in British Columbia to have some of the best public health experts in the world working in our health authorities and in our universities. And not only are they doing their own research, they're constantly reviewing research and data from both around the world, but also our local experience to bring that information to bear on the decisions that we make coming up. You may not know them, you may not see them regularly, but they are tirelessly working to keep all of us safe. And one of the things that they're finding is that regardless of where we may be in our province and what we may be doing, we have seen that indoor gatherings that are encouraging very close proximity tend to be an important source of transmission. The two notable things about these gatherings are crowding and, in some cases, alcohol. These are often small outdoor gatherings that are different from controlled settings such as an office or a classroom, where you know who is in the room and you can more easily take precautions. So that is why we're asking you to keep your group small, to spend time with people you know, and to always stay at home when you are sick. By doing this, you are supporting not only the public health teams, but your family, your friends, and your community to stay safe. While we still have much to learn about COVID-19, we do know that by continually monitoring for clusters, quickly managing new cases, and containing the spread, we can protect those most vulnerable and keep ourselves and our loved ones safe. Please do understand the risk and be an influencer. Support your friends and family to do the right thing. And we all recognize that this COVID-19 hasn't been easy, but we can be assured that by continuing to work together, we will get through this. And I'd like to thank you again for all you are doing. Thank you. And I'd like to hand it back to Minister Dix.
Thank you very much, Dr. Gustafson. And first of all, I'd like to say on behalf of the government, of the Premier, to express our condolences to the families and the friends and the communities and the caregivers of the two people who've passed away in the last 24 hours from COVID-19 in care in Fraser Health. We know what a difficult and challenging time this is, especially in families that are dealing with the loss of a loved one and the grief that that entails, and want to express our condolences to them and to the others who have passed away from COVID-19. That number now is 200, and while round numbers don't have significance in and of themselves, they remind us, I think, of the extent of the loss. We're also reminded during this time of pandemic, for example, in May and in June, of the 346 people lost to the other public health emergency we're dealing with in BC, the overdose crisis. And to all of those who've lost loved ones for all kinds of other reasons in BC. Yesterday, a very dear friend of ours, of our congregation, our minister and our friend Blake Field, passed away as a result of cancer. And I'd say that in the last 24 hours, our church community in this case has been dealing with this loss. Reverend Blake was an extraordinary minister and an extraordinary man. And I think what he probably reminds us of here today are things that are good public health messages, that we have to, in difficult times, seek ways to find joy and to find happiness and to be together either virtually or with our loved ones in ways that keep us safe. He'd probably tell us to lift ourselves up when we fall and to avoid at all costs blame. And we need to do this because we're going to be dealing with this pandemic for a long time. He'd probably tell us to protect and to empower the most vulnerable. And that has been at the core of what we've been trying to do with everything we've done in response to this public health emergency. And he'd probably tell us we need to support each other in difficult times, and surely we do, because these are challenging times and difficult times. We, like all of those who have lost friends and family in these times, we understand how difficult it is. And just like Blake Field, who was a wonderful guy, I wanted to say on behalf of all those people who are struggling in these times that we hear you and we grieve with you. I think that extraordinarily as well, I wanted to acknowledge the work of public health in this period. And that work is obvious to all of us, but it's obvious also in the statistics that we see every day. We've seen, as happens in periods when there are a rise in cases or when there's a rise in public anxiety, an increase in calls to our 811 service. And the work done by everyone at 811 is truly extraordinary. Just to consider, in the month of July, 70,668 phone calls answered. That's twice as many as in an average July. And yesterday, 2,728 phone calls answered. And of course, we increase in resources in response to public demand. You'll know that on March 25th, 5,070 calls were answered by our team at 811. And at the lowest point in the pandemic, in terms of calls, that number was 1,700. The number yesterday, as I said, was 2,728. We're also, of course, increasing the amount of testing we're doing, and we've significantly seen that in the last 24 hours as we've increased hours, operating hours at 5 centres in the Fraser Health Authority. That new temporary testing and assessment centres will be open in Surrey and Fraser Northwest in the coming weeks, and more staff is being deployed to Burnaby, to Langley, and to Abbotsford. In Vancouver Coastal Health, a new assessment centre opened yesterday, with an additional centre coming online in North Vancouver soon. Vancouver Coastal Health has also expanded hours of service in Richmond, with work underway to open existing locations for 7 days a week. The overall turnaround times in laboratory remains constant. In Fraser Health, it's about 26 hours. In Vancouver Coastal Health, 24 hours. In Vancouver Island Health, the turnaround time is 16 hours. So yesterday, for example, there were 4,207 test results. And as you can tell, with 80 positive tests, that means a positive rate of around 1.8, 1.9%. We also have, as Dr. Gustafson said, 2,574 people who are effectively under public health surveillance, who are self-isolating, and that is an extraordinary engagement by public health staff. The rapid response that public health does in outbreaks, such as the one at the Loblaws warehouse that Dr. Gustafson just referred to, but also, and importantly, in long-term care. In short, public health is doing what they do, which is to help people, to alleviate suffering, and to prevent the expansion of the pandemic, and to save lives. And what they're doing here on this typical day in August reflects how extraordinary that work is. I want to just briefly, and I'm sorry I'm taking more time than usual, I just have a couple of reports that we typically give on Thursday. On May the 7th, we, of course, released our commitment to surgical renewal. On May 18th, we resumed non-urgent scheduled surgeries. Between May 18th and August the 10th, we completed 77,864 surgeries, 59,446 of which were scheduled surgeries, and 18,418 were unscheduled or emergency surgeries. That's 14,670 in interior health, 21,863 in Fraser Health, 17,681 in Vancouver Coastal Health, 15,894 in Vancouver Island Health, 4,500 in Northern Health, and 3,256 in the Provincial Health Services Authority. Last week, we reported 4,718 surgeries were completed from August 3rd to the 9th. Health authorities have verified their data, and the total number of surgeries completed for the period is actually upgraded to 4,886. This period included the BC Day long weekend, or BC Day, when scheduled surgeries were not performed. This week, we completed 6,132 surgeries, significantly above last year's period. And as you know, vacation management is reducing the summer slowdown due to planned vacation by 52%. Obviously, some vacation time is now being taken, but much less than a typical year. I'm also pleased to report that mechanical issues with one of Northern Health's operating rooms were fixed August 14th. When we postponed surgeries, we made a commitment to patients that you are not forgotten. From ophthalmology to orthopedics to cardiac to thoracic patients, you have not been forgotten. The number of surgeries we report on each week includes surgeries from all of these areas. As we continue our commitment to renewal, we'll be profiling how we'll improve efficiencies and increase surgical cases in several of these specific surgical areas, beginning with ophthalmology. There are nearly 23,000 cataract cases waiting for surgeries, about a quarter of our wait list. I again want to express my appreciation to everyone who's involved in delivering our commitment to surgical renewal and our commitment to patients. With respect to long-term care, I just want to bring an update. Obviously, all visitor safety plans have been completed, and all long-term care homes, with the exception of those with active outbreaks, are seeing visitors at this time. As you know, practice guidelines were set in place on June 30th, and each long-term care or assisted living home has produced and prepared its visitation plan. Wanted to say that resources are being provided to assist facilities in adapting to these new guidelines, and this will be in the coming period up to 4 FTEs, or people per facility, full-time equivalent jobs per facility depending on size. This is up from 3 previously reported, as there was room in the funding envelope to provide additional FTE per site to offset administration costs. As you know, ministry staff are actively reviewing the social and family visitation policy now, as we promised to do. It's been in place now for a number of weeks, and we will take obviously a thorough and thoughtful approach to this review. In closing, I wanted to say that it's been a long time. Next week, it'll be 7 months since we started providing these briefings. It's been a long time since we started our COVID-19 response, which was in January, when the team set up that involves Dr. Gustafson and her team, but also led by Dr. Henry and our Deputy Minister, Steve Brown, has been in place. It's a long time to stay 100% all in. Twice during the past many months, I've drawn upon the words of Dr. Michael Ryan of the World Health Organization. Early on, he said something I've drawn upon when times were harder in our BC fight. He said that in a pandemic, we have choices. He said we can give up or we can fight. It's that simple, and it's that hard. We can give up or we can fight. So we look at our recent COVID case numbers and we ask ourselves, do we still fight? And I think we do. On Wednesday, we announced that as on August 25th, the state-of-the-art PET CT scanner will start helping patients at the Kelowna BC Cancer Centre. For the first time outside of Vancouver, people will be able to receive this care. And that was just on Wednesday. These past 6 months and beyond, each day, people across BC, exceptionally gifted people who work in healthcare, who work for healthcare, researchers, healthcare workers, and healthcare professionals at BC Cancer, and in all our specialized agencies and the health authorities fight. They fight to do better. So do their patients, and so do their patients' families. They fight to do better, pandemic or not. Each day they fight. People in healthcare fight alongside the patients who are counting on them. Do we continue to fight in our BC pandemic response? It's my job to say yes. It's my experience that we can and we do, and it's my belief that we will. And to do that, we need to make a commitment to ourselves, to make sure we're renewing our spirit, to make sure we're restoring our energy, to make sure we're up to the fight. We take a long view in a pandemic, but this weekend, let's take a shorter view, one that sees us step away from the coverage of COVID to safely living our lives despite it. The activities we do, the outings we can take, and the connections we can safely make that remind us of what we have to do in our lives, of who we have in our lives, and how we are renewed and restored when we strengthen these connections. Everybody has their own comfort zone. Within it this weekend, let's head to a park or a beach and stay and work and be with those in our bubbles. Walk our neighborhoods and see our neighbors at a safe distance across a fence or in their garden. Visit grocery stores where hardworking people are working to keep us safe and have been from the beginning, and to whom we owe an extraordinary debt. Call or do a video connection with friends or family we've not seen, or who can't get out to enjoy the things that many of us take for granted. It's always worth doing that. There's always the day that comes in all of our lives when we wish we had done that with someone we had spoken to. Run an errand for someone. We know what skills to use to do all of these things safely. Dr. Henry and I will see you on Monday. It's been an honor to stand with Dr. Gustafson this week, who is an extraordinary professional, representing many more extraordinary professionals and healthcare workers. Next week, we start a brand new week. But this weekend, let's take time for ourselves and those we care about. Let's take care. It's been a long time, and we need each other to be at our best. Aujourd'hui, nous annonçons 80 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 4 825 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 2 nouveaux décès liés au COVID-19 dans la région de santé de Fraser, pour un total de 200 décès en Colombie-Britannique. Nous offrons nos condoléances profondes à tous ceux qui ont perdu leurs proches durant cette pandémie. Chaque région de santé de la Colombie-Britannique compte des patients atteints de COVID-19. 1526 se trouvent à Vancouver Coastal, 2533 à Fraser, 159 sur l'île de Vancouver, 411 dans l'intérieur de la province et 121 au nord. Il y a aussi 75 cas de personnes qui vivent en dehors du Canada. Parmi l'ensemble des cas confirmés de COVID-19, 11 personnes sont actuellement hospitalisées, dont 4 en soins intensifs. Merci beaucoup. Thank you very much. Dr. Gustafson and I are happy to take your questions.
Thank you, Minister. And before we take questions, a reminder to the media to please press *1 to line up for questions. We will be taking one question and one follow-up this afternoon. And please do not mute your phones. You will not be heard until I call your name. We begin today with Keith Baldry, Global News. Keith, go ahead, please.
Hi, thank you for this. Regarding your talking about 811 calls, there's been a serious surge in the number of those calls. If we keep on our average this month, August will see more calls than any month dating back till March. I'm just wondering, is that an indication that the public feels a lot of anxiety right now, that more people than since the beginning of the pandemic are dialing the service that leads to testing?
Well, it doesn't just lead to testing, although you're quite right. That's one of the questions it does. Just to put it in context, the total calls answered in March were 41,880, but on the highest day in March, we answered 5,070 calls, or 811 answered 5,070 calls. On other days, for example, March 26th, that number was 4,902. And that has gone up and down, reflecting a little bit the ups and downs of the pandemic. Yes, there's no question that we've received more and answered more calls recently. As I say, yesterday that number was 2,728, which is similar, for example, to July 27th, when it was 2,668. At that time, there had been lots of expansion of interest and calls from the Interior Health Authority. So the number we received yesterday is relatively high compared to the average, and certainly compared to before the pandemic, but it's less than some days in July as well. Clearly, we've tested more people in the last 24 hours, I think over 4,000, which may be the largest number we've tested, and the 811 services is expanding. I wouldn't say that the number of calls is anything like at the height of the pandemic in March, but it reflects the fact that public health is there to support people. The 811 call and especially the team of nurses that work at 811 have done an exceptional job from the beginning of the pandemic, and will continue to be there for people, just as all the other people who both perform the tests at testing sites across the province, but also the teams at the BC CDC and those associated with them who evaluate the tests and provide the results. It is an extraordinary team, and the increase in 811 calls is a reflection of our continuing determination to provide care and service and prevention and advice and support throughout the pandemic.
Follow-up, Keith?
Yes, the number of people in isolation, more than 2,500, is more than doubled in a little more than a week. I know the case numbers, of course, are higher than they have been, but is this an example, and I think you mentioned this in the opening remarks, of contact tracing really being effective here?
Yes, so one of the reasons that the number of people who would be in isolation would increase is if a single individual who was infected spent some time in gatherings. And we have been talking about gatherings. So the number of people in isolation reflects the type of places where the exposure has occurred and the number of people that have been identified. And so it really is it's a reflection of how the types of exposures there are and the intensity of contact tracing that's happening by the public health teams.
Thank you. The next question goes to Laura Braham, CFAX 1070. Laura?
Hi, so you mentioned that the new cases today are largely people in the ages of 40 to 60. So previously you've mentioned that cases in young people happen largely at parties or gatherings. Is there a trend in the new cases today, or how are these people infected?
So just to clarify, actually the majority of new infections do continue to occur in the young adult population. What my remarks were about the fact that we're seeing a small increase in a slightly older population, and that's an important thing for us to monitor because the risk of severe illness goes up with age with COVID-19. So at this point, that increase is really quite small, but my comments were really relating to the fact that that's a trend that we monitor on a regular basis because one of our goals is to protect those who are most vulnerable to severe illness.
Do you have a follow-up, Laura?
No, thank you.
Thank you. The next question is from Srishti Gangdev, CKNW. Srishti, go ahead, please.
Hi, thanks for this. I'm just wondering, in Alberta, Dr. Dina Hinshaw has tweeted out that everyone who's going back to school, so that includes teachers and school staff, have been invited or encouraged to get tested before school starts. I'm wondering, in BC, I know we have stayed away from testing asymptomatic people, except in some cases, like I believe at Mission Institution, there was testing of everyone. Or not. Is that an option that BC will be looking at for schools?
It's not an option that the science tells us we should take. We have actually, we look at the evidence very thoroughly and make decisions based on what is likely to make a difference. One of the things we know about testing people who do not have symptoms is that the yield or the positivity rate is extremely low, and because the sensitivity and specificity of the test, and that tells you how many of the true positives and true negatives you pick up, really declines in testing that is associated, in people who don't have symptoms. So basically what you find is that neither a positive test nor a negative test tells you a great deal in that situation. So no, we would not recommend that as one of the ways that we want to make sure that people stay safe and are safe. And so that is not something I'm anticipating in British Columbia.
Follow-up, Srishti?
No, thank you.
Thank you. And the next question is from Sarah Reed, CTV. Sarah, go ahead, please.
Hi, thank you. I was just wondering what thoughts are on BC Ferries making masks now mandatory instead of having that as a recommended suggestion for travelers.
So we know that that masks, albeit they are the lower on the hierarchy of interventions, are often a very visible sign that people and organizations choose to implement. And so, in the context of situations where you are interacting with individuals whom you don't know and with whom you may not be able to keep a significant distance, the additional layer of protection that masks provide can be helpful. With respect to making it mandatory or recommended, that's often the decision of the organization that puts that policy in place.
Follow up?
Yeah, just with the mention of the number of calls and the turnover time for test results, we're hearing that Island Health is facing a lot of technical problems with their phone lines. So it's actually preventing people from being able to make an appointment to go get tested. What is your message to the people who want or need to get tested to see vulnerable family members but can't right now because of this issue?
I think it's being resolved. So my message is that we resolve these problems as we go forward. The relative turnaround of testing results on Island Health and tests take place is relatively low, and of course, the positivity rate is relative. Basically to anywhere else in the world, minute in Island Health right now. Just to put it in context, there are 9 active cases on all of Vancouver Island at present, and obviously, and you'll see because you're following the dashboard every day that the relative number of people who test positive in Vancouver Island is very small, and we're very proud of our teams there. But I want to emphasize this point about Island Health, and it's why people sometimes ask, well, why would you continue to have policies in place to protect people that are similar to other jurisdictions? This is partly because we should remember that different communities have different levels of vulnerability. And while we haven't seen outbreaks of large numbers on Vancouver Island, in fact, the rates the rate of positive tests is lower than any of the other health authorities in British Columbia. There are many communities, because of a relatively high elder population and therefore a high population of people with chronic diseases, there is ultimately more vulnerability on Vancouver Island. That's why we continue to have that policy in place. The problems with respect to calling, I think, are being resolved, either have been resolved or will be resolved shortly, and so that problem will be resolved, and we apologize for any for the inconvenience and concern that caused.
Thank you. The next question comes from Yuji Zhang, Omni News.
Hi, thanks for taking my question. So the province has announced the hiring of 500 additional people to help with contact tracing. So do you have some more details to provide at this moment, such as the recruiting timeline, and if the actual workforce will help work on some new contact tracing technologies?
So I can follow.
Yes, we've received, and forgive me, I don't have in front of me the email for people who may be interested in these positions, but in front of me, but it's available. And if you go to the BC government website or the BC CDC website, you'll be able to easily find that to express an interest in these positions. We've had hundreds of people respond to those positions to be to work in contact tracing in this pandemic. I want to say two reasons why it's important. One, we have a significant group of people obviously engaging in contact tracing now. You can see this based on what Dr. Gustafson has reported. What we want to do is increase our capacity. So should the need for more contact tracing increase in the fall, we are able to respond to that with staff that is there. Should that not happen, then the hiring of these 500 contact tracers will allow the rest of our public health professionals to go back to their regular duties in addition to things such as contact tracing in support of public health across BC. So the response so far has been excellent. We're in the process of and will be for September of hiring those contact tracers, and I'll be happy to report on that progress in the coming weeks leading into September.
Do you have a follow-up, Yuji?
Yes. So I would like to know if we see like a more severe resurge of the COVID cases, how are we considering about introducing some new technologies to improve and enhance our current system of contact tracing, especially to trace those hard to trace community outbreaks?
Yes, I think the short answer is yes, that we are, and working with the federal government and working with other provincial governments. The federal government has developed an app which is currently being worked on with the government of Ontario, which we worked on to develop the app, and we hope to add that to our efforts here in BC. But, and I'm going to invite Dr. Gustafson, who knows about 7,500,000 times better than me this subject, just to say that we believe in BC. And you can imagine if you were to test positive for COVID-19, to have an experienced person talk to you directly as a person yields better results. It's why we believe in the contact tracing by people, why it's been so effective, why the contact tracing we did, especially in February, limited the growth in that period of COVID-19 in BC. It's extraordinary work that's done, and it's the bread and butter work of public health, and I'm going to leave it to Dr. Gustafson to talk about it a little more.
Thank you very much. And yes, we are exploring technologies and information systems that can enhance the work. But as Minister Dix has just said, contact tracing is actually a clinical practice. It's actually clinical care that you're providing to someone who's either has COVID-19 and is worried about their loved ones, or somebody who may have been exposed to COVID-19. So the essence of the work is actually care. It's providing care for people again, who may be cases and contacts. And that's why hiring people and training people and make sure that they can provide accurate and skilled advice to people who are in that situation is such an important intervention. Contact tracing is actually quite a skilled clinical practice, and we have a lot of skilled individuals who are doing it, and expanding that capacity is really what we need to do to make sure that people who have COVID-19 and are worried about their loved ones, or people who may be told that they've been exposed to COVID-19 and have really important questions, get those questions answered.
Thank you. The next question comes from Marcella Bernardo, News 1130.
Hi, Minister Dix and Dr. Gustafson. Thank you for taking my question. We have been getting some complaints from people who say that they want to get tested, they're told to get tested, and then when they go line up, they can't really find anywhere where they don't have to wait a long time in order to get access. And I know that you mentioned earlier that the ramping up of tests, but we've been told that up to 8,000 tests a day could be done daily, but the numbers are much lower than that. If you could elaborate on that.
Well, I think if you look at the last number of days, and we're not, there's no secrets about any of this. The number of people we test is on the BC CDC dashboard, of which Dr. Gustafson is justifiably proud because of the information it provides. We provide that information every day, and what you're seeing is exactly that, a response to public demand for more testing. So I think, I believe the number today, and this will be confirmed by the dashboard at 5 o'clock, is around 4,200 tests that were performed yesterday, of which we had 80 positive tests, as Dr. Gustafson has reported, and that's an increase in the demand for testing that we saw before that. And so what we're doing is responding to that. We do have the capacity for 8,000 tests, and respond to that by extending hours, by adding more staff, in some cases adding new lanes, in some cases opening new sites to respond to that. If the public demand is 1,800 tests a day, you don't want to have people there prepared to do 5,000. You want those things to work in concert, and that's what's happening. The 8,000 capacity, therefore, is twofold. You need people to essentially take the test, but you also need to process the tests and get the results. And so our capacity to do that is around 8,000 and can rise to that right now. And our goal in the fall and cold and flu season is to increase that up to 20,000 so that we can provide even more rapid response. It may be, once we increase our capacity to 20,000, that we don't need to perform anything like that level of tests. But just like we responded in advance in March and prepared based on what we knew at that time, prepared our hospitals to be prepared for COVID-19. We're preparing now in myriad different ways for the situation in the fall, and this is one of the ways that we're doing it.
Do you have a follow-up, Marcella?
Yes, this is actually for Dr. Gustafson. I'm getting lots of emails from people that are still concerned about just how airborne this virus is, and that they're worried that there's a lot of research out there suggesting that it can live a lot longer in the air than it does, and that we're not really getting the full picture about this.
Well, those individuals can really be reassured. Whenever you have a new virus, there are a lot of studies that are done on what can happen. But what really matters to us is what does happen. And we are over 20 million infections around the world, and the behavior of this virus is now known. And we know that the way it's behaving is that it's transmitted in situations with close proximity with others who are infected. And that is not the feature of an airborne virus, or not a feature of a virus that is transmitted efficiently when airborne. These are the features of viruses that are transmitted through close proximity, through what we call droplet spread. The other thing we know is that if there was a substantial contribution of airborne transmission to COVID-19, then the things we are doing that are actually stopping transmission wouldn't be working. So basically what we know is that there are a lot of studies out there that explore what's possible. What matters to us is what's probable and what's actually happening. And this virus has told us how it's behaving, and the way it's behaving is not airborne spread.
Thank you. And the next question comes from Nick Johansson, Castanet News. Nick, go ahead, please.
Hi there. I'm not sure who this question is best suited for, but with the fires here in the Okanagan, what, if any, changes have been made to evacuation protocols in light of the pandemic?
So we have been working with Emergency Management BC and have created specific guidelines to make sure that the evacuation processes and centers are taking into account the potential for COVID-19 transmission. So to make sure that those activities include the prevention measures that we need to have, such as hand hygiene and appropriate separation. So, do want to tell you that some time ago, actually, at the beginning of the pandemic, or I would say at the beginning of the summer, the combination of these events were considered, and the plans and evacuation plans were adjusted accordingly.
Follow-up, Nick?
Of the people who've been evacuated here in Penticton, do you know if any of them were being required to self-isolate, whether they were COVID positive or because they'd come in contact with a COVID positive person?
So such an event has not been reported to me. So my understanding is that at this time, there are no individuals in that situation reported. However, if that changes, we certainly will update you.
The next question comes from Mary Griffin, CHEK News.
Oh, hi. Thanks very much. It's just a question about some medical clinics that are offering COVID testing for asymptomatic clients that come in, and I'm just wondering what your thoughts are on those.
So in British Columbia, after careful review of the evidence, we do not recommend testing of people who do not have symptoms of COVID-19. The test itself does not perform well in that situation, and the results are generally not going to change what you do or what you do in terms of management. So asymptomatic testing testing of asymptomatic individuals is not something that we recommend in British Columbia as an effective way of controlling the transmission of this disease. In exceptional circumstances, when a medical health officer is managing an outbreak, they may consider that as a strategy, but it's certainly not recommended in general.
Do you have a follow-up?
Okay. I was just wondering when Minister Dix was talking about testing, and I think I missed it, he said that the positivity rate was 1.8 to 1.9%. Is that number unusual, and what does that number tell you?
Well, it's not an unusual number. It basically tells you that the vast majority of people right now who are being tested are testing negative for COVID-19. A very high rate of positivity could mean one of two things: you're testing the right populations, or there's an actual increase in testing and increase in infections. It is a way of comparing testing capacity with the actual circulation of virus in the population. I don't know if Minister Dix has anything to add to that. It's something that we do like to monitor as an indicator of making sure that we're testing the right populations and that our testing is appropriate for the level of circulation of virus.
Thank you. The next question comes from Glenn Korstrom, Business in Vancouver.
Hi, yeah, thanks for taking my call. The question is, it's sort of a follow-up for Minister Dix. I asked you about a month ago about the hiring at seniors' homes, care homes, so staff aren't expected to manage all these complex visits along with necessary tasks. And you said there was $165 million going into hiring new people. Have people been hired? How is that going?
The $165 million is a different number, Glenn. The $165.4 million is the cost of the single site proposal, which is obviously an important proposal and one that we're implementing across the province, and the monies goes to people retroactive to the putting in place of the single site proposal. The number I think on this was $160 million, is a similar number, and that work in some places has happened or is happening, and that's the number that will be available. I mean, what we have to do with the visitation policy, one of the reasons we started, as everybody knows, because many people would like to see the visitation policy expanded as someone with family members in long-term care. I would want that as do want that as well. But I think that one of the reasons we started so cautiously is it's going to take some time to put all of these measures in place. So we started cautiously, so it's one designated visitor per person in care. But that work is ongoing with all of our different care homes in the province. And I think you're going to see some significant announcements around recruitment, because remember, if you're talking about 3 to 4 people per eligible care home, we're talking about the hiring of people in the thousands. And so some significant work is being done on this, and you should expect to hear even more details about the largest bolus of the hiring soon.
Do you have a follow-up?
Sure. On the one designated visitor, I know there's some homes now that are allowing multiple visitors as long as the people are outside and spaced out, and the resident is either in the doorway or also outside. I'm just thinking, when the weather cools and visits are more inside, will the one designated visitor be more stringent, or a policy that's more required?
Well, I think it's fairly stringent now. Just to say what the practice guidelines are, Glenn, each senior will be allowed a designated visitor who will meet them in a designated visiting area at their care home. The facilities will have dedicated staff person to screen people as they arrive and to provide guidance so that visitors and residents can safely visit. The visits must be booked in advance, and visitors must bring and wear a mask. And obviously, as you've noted, resources are being provided to assist facilities in adapting to these guidelines and any changes that would happen in the future. And we're reviewing that now. There are slightly different circumstances in terms of what happens in some care homes outside, but essentially the designated practice is supported practice, and that laid out by the provincial health officer and the Ministry of Health is that each senior or person in care will be allowed a designated visitor. There are, of course, exceptions to that under our essential visits policy, which you will know, in specific circumstances, in palliative circumstances. People living with disabilities, for example, both in acute care and in long-term care, have access to advocates, and those changes were made in May. But essentially, the designated visitor policy has been in place, was announced June 30th, has been in place in most care homes since about the third week in July, and is being actively reviewed now.
Thank you. The next question comes from Lisa Cordasco, CHLY.
Thank you very much. As I understand it, the BC Lottery Corporation is working with casinos on reopening plans and what would be required. And I'm sure you're aware, Dr. Henry has said casinos would be the last place she'd open. Given our COVID numbers at the moment, how likely is it that casinos will reopen soon?
Well, I think I will leave the likelihood to Minister Dix, but one thing, if I may say, one of the things to consider is that if you consider what we now know about COVID-19 and COVID-19 transmission and who the vulnerable populations are, COVID-19 transmission is highest risk in close settings where people are in close proximity, especially if they are interacting quite a bit or are touching many things, and especially if some of the behaviors are altered by alcohol. We also know that as people get older, their risk of severe disease increases. So from a disease control perspective, these would be particularly worrisome places to reopen.
I wouldn't expect any change to the current rules on casinos anytime soon.
Do you have a follow-up, Lisa?
Thank you. Yes. I'm wondering, Doctor, if you can tell us anything about the cases in Island Health, which, looking at the dashboard last time and the surveillance report, looked like they weren't travel-related, but community exposure. So can you expand on what that means?
So when we report cases as an exposure in the community, early on it can be, as the investigation goes on, it means that these individuals didn't necessarily get it from a known case or a known cluster, but they were exposed somewhere in the community. Often early in the investigation, we don't know where that is. One of the things that we are finding, however, is that as the investigation proceeds in British Columbia, at this time, in the vast majority of cases, the source of the infection is identified. And that's really important because as long as the majority of our cases are among people where we can actually identify the source of infection, that means that we have known chains of transmission, and through the public health tools that we have available to us, such as identifying contacts and asking them to self-isolate, we are able to control transmission. So we do monitor that, and that number changes, and often early in the investigation it's higher, and then as we conclude the investigation and speak to more contacts, we in British Columbia throughout this pandemic have been able to identify the vast majority of sources of infection.
Thank you, and we have time for one more question this afternoon. For any reporters that didn't get a question today, there will be a statement released shortly. For recommendations on protecting families and communities and for access to provincial guidance on COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And the last question this afternoon comes from Tanya Fletcher, CBC.
Hi there. School districts, including the Vancouver School District, are starting to lay out their back-to-school plans. Some parents are concerned about the lack of physical distancing measures when it comes to students within the classrooms, even within their learning cohorts or groups. So if physical distancing isn't possible in a classroom, will the primary strategy be simply to rely on contact tracing if something happens rather than trying to prevent spread among those classroom groups?
No, actually the plans are very much designed first and foremost to prevent cases of COVID-19. And physical distancing is a gradient. It's not an absolute. We often tell people provide the guidance of 2 meters, mostly between yourself and strangers in public. But we know that the other end of the gradient is to reduce really close face-to-face contact with individuals. And there are absolutely ways to do that in the school setting. So in other words, what we know is that the vast majority of transmission occurs through very close contact, face-to-face contact with somebody who's infected. So actually physical distancing is possible in the school setting. The strategies are going to be different than what we use in general in public, and we know that it's part of a comprehensive set of interventions that reduce the risk of transmission in the school setting, such as hand hygiene, such as making sure that kids are supported to stay at home when they are sick, that staff are supported to stay at home when they're sick, and generally reducing crowding in the school setting. So that's, I think, is important and absolutely part of all plans. I do, however, think it's important that identifying cases of COVID-19 and clusters of COVID-19 and how we would respond to that must be part of the plans as well. Schools are inseparable from the community. They're part of the community. They reflect what's happening in the community. And in the community, our plans to control COVID-19 span from prevention to response. And the same thing needs to happen in schools.
Thank you. Do you have a follow-up, Tanya?
Please, thank you. I'm wondering if you can elaborate a little more on the outbreak in Fraser Health at the Loblaws. I believe you said it was a warehouse. So did this affect staff only, and did those 9 presumably employees travel to any Loblaws stores as part of their job or other facilities? And an answer in French as well, please. Thank you.
Okay. So my understanding is that at this point, the individuals who are identified are staff at this warehouse. Should there be changes to that, I can certainly update you on that, and I won't even attempt French.
Oui, il y a 9 personnes qui travaillent pour Loblaws of Surrey qui sont en question pour un test positif de COVID-19 actuellement. Et donc, on a déclaré cette situation à cause du fait qu'ils travaillent ensemble dans cette entreprise. Donc, il y aura un communiqué de Fraser Health, je pense, qui va être présenté dans peut-être les minutes ou l'heure à venir, et qui va donner plus de détails sur cette question, mais à force est de reconnaître que tout ce qu'on fait, chaque fois qu'on a une situation comme ceci, on fait cette situation, Et on a travaillé, comme vous le savez, à Fraser Valley Packers, où il y a actuellement, et depuis maintenant plus qu'une semaine, je pense, 77 personnes qui ont eu un test positif pour COVID-19. Donc, on va faire le même travail à Loblaws. Une chose importante à ajouter, c'est que ce n'est pas une question d'avoir peur de la nourriture en question. La nourriture à Loblaws, qui est bien, mais il faut prendre les mesures qu'on prend, que ce soit cette période de pandémie ou d'autres périodes, pour assurer la protection de tout le monde. Donc, avec cela, thank you very much. Merci beaucoup. Until Monday. Thank you.
Thank you, and thank you all for participating.